Today's video is going to discuss what to do for patients that have already had a heart valve replaced. Earlier videos I discussed valve problems, and I also have a video about different, what we call percutaneous, which are ways of repairing or replacing valves through an IV, or surgical solutions to valves once they can't be controlled medically anymore. Several of my patients have come in since those videos having a valve replaced and said, you don't have any video that talks about what I need to do now. So what happens for the next year or the next 3 years or 5 years? Well, what I've actually said to all of those patients is, it's not the next year or 3 years or 5 years, it's what's going to happen for the next 30 years. And frequently they say, so I'm going to be fine for 30 years. Well, I'm hoping they're going to be fine for 30 years, and I'm hoping the valve lives 30 years. So the questions that they have is, what can they do or what should they do so that they don't have to go through another valve procedure? Part of that relates to the type of valve, and I didn't really specify types of valves because some patients come in saying, well, I want a metallic valve, or some patients say, I don't want a metallic valve, I want a tissue valve. There's pros and cons of the different valves, and if you're a patient where a surgeon or a cardiologist is telling you that you need to have your valve replaced, make sure you talk to your physician and ask about the pros and cons of the different valve types. Mechanical valves can live forever, but depending on what type of mechanical valve and where within the heart, you may need to be on a blood thinner, which you may not need if you have a tissue valve. Well, some tissue valves, depending on your other medical problems, you may also need to be on a blood thinner. Mechanical valves, if they fail, can only be fixed with a repeat surgical procedure. Tissue valves, if they fail, can often be fixed with a non-surgical procedure. So it's not just the pros and cons of how long do I think a specific valve is going to last. It's what other medications will I need if I have this valve put in, and if a valve fails, at what age am I, how long do I think the valve is going to live, and what needs to be done at that point in time. Well, the goal of this video is to say, I don't want my valve to fail. So how can I prevent that from happening? Some valves can fail suddenly if, for example, you go to the dentist, you get a root canal, that gets infected. If that gets infected and you have a prosthetic valve, that infection can cause bacteria to go in the bloodstream. If there's enough bacteria in the bloodstream, that can settle in the heart valve. Whether it's a mechanical valve or a tissue valve, that can cause that valve to fall apart over a very short period of time. And those are typically not good things. And almost all of those need surgical solutions. Antibiotics, yes, but if the valve is affected enough, a surgical solution is usually the option. For some of them, at some point in the future, we may be able to replace it with a valve through an IV. At this point in time, fall of 2023, that's usually not an option. How else do valves fail? Well, some people, they can grow tissue over the valve. And if you've ever seen some people where they have a scar on their arm, and there's a lot of lumps and bumps that form over the scar, it's what we call keloid. But some people can form tissue overgrowth of the valve, and we call it pannus on the inside. But people can form that over the valve that starts restricting the valve opening. Other patients, you have to realize, when you weigh too much, in a regular heart and a regular person, the heart expands and the valve opening expands a little bit. Well, if you have a water main going to a small house and it's a 1-inch pipe, and you say, oh, I want to make a huge house. You can build a huge house if you have the same 1-inch water main that goes to the house, and you're washing dishes, your wife turns on the dishwasher, and you have a kid that's in the shower, and the kid says, I'm not getting any water. There's not enough water coming in from that water main to the house. Why do I bring that up? Well, when we put in a valve, that valve is a specific size. So for example, if it's a 26 millimeter valve, that's great for a person who weighs 180 pounds. If that person goes from 180 pounds to 360 pounds, they need to get twice as much blood flow through this. Well, twice as much blood flow, unfortunately, means you essentially need twice as big a valve. That valve can't grow, so that valve is working on overdrive. And at some point, not enough blood can get pumped out to the body. And the valve is much more likely to fail, number one, but number two, patients are likely to not tolerate it because they can't get enough blood out to their body. So blood will build up, and that will lead to what we call congestive heart failure. So it's very important once we replace somebody's valve, and even more important when we replace somebody's valve, for them to maintain a healthy lifestyle. So maintaining weight with both exercise and diet is a key thing. I have separate videos that talk about diabetes. One of the problems with diabetes I didn't talk about in those videos, once you have diabetes, it's much harder for your body to fight infections. So valves get infected much more frequently in diabetics than non-diabetics. Diabetes is also caused in large part by being overweight for too long, which is another cause of valves failing over a period of time. So preventing yourself from getting to the point where you are diabetic, or when we replace a valve, if your weight is too high, obviously it's too high, and hopefully your physician has spoken to you before about exercise, diet, and trying to get weight down, but it's even more important once you have a valve replaced to do that. Every patient has been told by their doctor that if they smoke, they need to quit smoking. If you've already gone through a procedure where we've replaced your valve, and you still smoke, you are giving a finite lifespan to that valve, which is sooner than later. So it's a patient's decision. If they decide they want to keep smoking, that's fine, but they're much more likely to have the valve replaced at an earlier point in time, just like the weight issue would be, than if the weight's controlled or they quit smoking. Other issues with prosthetic valves relate to medications. If you're on a blood thinner, there are newer blood thinners that I've talked about in separate videos called Eliquis or Xarelto or Pradaxa. Pradaxa was the first of the new blood thinners that came out after warfarin, and there was a trial that looked at that in prosthetic valves, and unfortunately patients that took Pradaxa versus warfarin not only bled more, but had more clots form in the valves. So they did worse all around. The newer agents like Xarelto or Eliquis, there is some data with those drugs that show they may also not be as good as warfarin for prosthetic valves. So once patients have a prosthetic valve, at this point in time, we still recommend warfarin, which means you need to have your blood levels checked and it needs to stay within a certain range. It depends on whether or not you have a mechanical valve or a tissue valve that determines how thin we want the blood. Mechanical valves, especially if it's a mitral mechanical valve, we want the blood thinner than just for people who have atrial fibrillation, for example. But drugs do vary with artificial valves. If you are going to see a dentist or you're going to have procedures that are non-sterile procedures like a root canal, once you have a prosthetic valve, we do want people to get antibiotics before they see the dentist and have a procedure done. If it's a sterile procedure, you don't necessarily need antibiotics, but that would be something that should be discussed with your cardiologist or the physician who put in the valve if it's a cardiothoracic surgeon prior to having a procedure done, not after the procedure, and oh, should I have done this beforehand? Interestingly, my department chairman, who comes from Texas, raised a good point. Having a root canal is not the most common cause of getting what we call endocarditis, which is an infection in the valve. The most common cause is eating nacho chips. The theory is that eating nacho chips causes enough small lacerations inside people's mouths that leads to enough bacteria in the bloodstream to affect valves. Eating nacho chips is obviously much more common than having a root canal. So I would suspect that the root canal is still worse than eating nacho chips. And if part of this video is to get people to lose weight, I don't think there's a healthy Dorito that's on the market, although they do taste good. But anything that can cause bacteria in the bloodstream, once you have an artificial valve, you need to be careful with, and that's the point of this. I hope you have a good day. If you have questions, please reach out to me anytime.